A new study suggests too much belly fat, even in people at a healthy weight, could put them at increased risk for heart disease. That's according to a study published in the Journal of the American Heart Association. Dr. Reena Mehta joins us this morning to go over what it means and what you can do about it. Hi, Dr. Mehta. Good morning.
Hi, good morning. How are you today?
I'm good, thank you. All right, so we've been hearing for a while that, increased belly fat can increase your risk for heart disease. So what's different about this study?
Okay, so this is a great question. And so we've looked at multiple studies looking at independent risk factors for heart disease. And traditionally, when we think about being obese or overweight, we use BMI or body mass index to measure that. Well, some recent data has come out that actually shows that you could even have a normal BMI and maybe even a normal weight, but having increased fatty tissue in your midsection or in your abdomen is actually its own independent risk factor for cardiac disease, and maybe even a greater risk factor than actually having an elevated BMI.
That's scary because you might think that you're, an average weight or even a normal weight, so you might not think that you have a high risk factor, but then just by having a little bit of extra around the belly, that could really increase it.
Exactly. So the American Heart Association released a statement a week ago basically stating that having increased, we call it adipose tissue or fatty tissue in your midsection and going deeper into what we call the visceral or deeper organs actually has been linked to increased rates of high blood pressure, high cholesterol, diabetes, and even negative cardiovascular risks such as heart attacks. And so while you might think, well, my overall BMI or my overall weight isn't too bad, if you are depositing that fatty tissue in your midgut, that's actually a worse or greater risk factor. And, certainly need to take a step back and say, well, what can I do about this? Because obviously that can be concerning.
I mean, I guess, can you just try to target that area?
Yeah, I mean, that's exactly what it is. So, there's been studies that have shown that increasing your physical activity can actually be the one thing that can help. So obviously we know diet and exercise and lifestyle changes, but really the recommendations are 150 minutes of physical activity. So moderate intensity physical exercise a week can help and decrease, you're not just trying to change your weight, you're trying to change your inches around your waist circumference. So even if your weight doesn't change, even if you say I'm exercising, but I'm not losing weight, the point is that you're trying to lose inches around your waist circumference because that can actually be protective.
Now, how much does family history, genetics, play into all this?
Sure. I mean, of course, that is one of your big risk factors that you always have to think about is your genetics, your family history, and what's happened there. So that is an important contribution, but that's something that you can't control. What you can control is, sort of how you place your lifestyle and how you do certain things such as exercise and diet, and even strength training. So there's been studies that show that strength training and toning your midsection can actually be protective as well. So it's not all aerobic activity. You can do aerobic activity and cardio along with toning and strength training, trying to get those inches around your waist circumference down.
Yeah, we talk about, diet and exercise all the time, but sometimes even just the little bit of change can really make a big difference.
Well, that's what it is. I mean, even if you're, like I said, if you feel like you're not losing the pounds, but you're toning, that's great and that's beneficial because, like I said, if you can keep, your gut area down and your waist circumference down, then BMI may not even matter and weight may not even matter. So, I mean, they're all independent markers of obesity. And so really now national organizations like the American Health Association, American Heart Association, for example, are now using waist circumference as a tool to also use as a link for predicting heart disease and obesity.
Well, it's interesting stuff. Thank you so much, Dr. Reena Mehta, for bringing that information to us. We appreciate it.